The recent rise in cholera have spiked fear in the mind of many. 18 out of the 36 states of Nigeria are affected by cholera epidemic, with 3,650 cases and 47 total deaths reported in the last 2 years.
Yes, currently there is outbreak of cholera in some part of the state of the country because of poor hygiene and poor access to potable water supply, and then poor sewage disposal in the country. So, and that could be traceable to the fact that there is problem in some states of the country because cholera is common among people in the camp, people who are living in rural area setting, and who do not have access to potable water, where hygiene is not optimal. So that should be the reason, because people in the north, where there is Boko Haram insurgency, and they can also they can also be exposed to the outbreak. So I agree there is outbreak of cholera in the country currently.
Cholera, which remains a global threat to public health and a key indicator of lack of social development, often starts with stomach cramps, vomiting, and diarrhea, and if left untreated, may progress to fluid losses, resulting in severe dehydration and consequently kidney failure, shock, coma, and death.
I'm not the patient because a case of cholera in a state is a problem. So government will not downplay that. So, but in my year of practice, I've never seen a case because cholera is it might not be a mind. It may not come with mind symptoms. It could end up with a fatal symptoms. The patient come down with diarrhea, with profuse watery diarrhea, and the stool, we call it rice water stool, and that could also cause dehydration and hypovolemic shock.
And because of the economic of Nigeria, they are bringing so many dirty things for us to buy, and the poor people. And you know that in situation of Nigeria now, poor people are many. They are so many, and they are buying what they see. So because of that, cholera is very rampant.
The bacterial disease is usually spread through contaminated water. The risk of a cholera epidemic is highest when poverty, war, or natural disasters force people to live in crowded conditions without adequate sanitation.
What I can say is about the food we are eating. People are not eating good food again. And then where people used to stay to eat the food, there are many people that are preparing the food. They do not know where the food are coming from. They will just see anybody. They will just say, I want to buy this, I want to buy that. They will just be taking all the foods and the water. Even some people that are doing pure water now, their water is not clean. They are just calling it pure water. Even some Ragolis for herself is not pure. So they are just doing it. People are just trying to make money. So where they are doing all those things is not good.
So people should ensure that they wash their hand. They should boil their water, cover their water. They should make their food at home, and should dispose their sewage properly to prevent the spread of this. And if you have a friend, a neighbor, a family member who has symptoms, who has the following symptoms, who has diarrhea, profuse watery stool, who is tired, who is weak, who is vomiting, and I said something about the characteristic rice water stool. Please, such person should be taken to hospital for proper medical care, because if the patient is not well attended to, we could lose such patients.
Advice for them is to be boiling their water. They should be boiling their water and let it settle, and this thing can minimize the rampart of the cholera.
With steps taken by the Nigerian Center for Disease Control, activating a multi-sectoral National Cholera Emergency Operations Center (EOC) to tackle the surge in cholera outbreak, there is need to advocate for improved access to clean water, proper sanitation and hygiene. This is a critical measure to prevent cholera case and outbreak.